Home is where our stories begin. Our Town, Our Kids works with local Kansas communities to reduce the number of their youth at risk for involvement in the juvenile justice system.
Hi, I'm April Terry, and I'm here to introduce you to trauma-informed care. Broadly speaking, trauma-informed care means consideration for the impact of traumatic events, such as maltreatment, domestic violence, and the effects of poverty on children and families, with the goal of incorporating practices that acknowledge the effects of current and intergenerational trauma. This is a paradigm shift from what happened to you rather than what's wrong with you. With this in mind, we will now further define trauma-informed care, trauma-informed services, and guidance on creating a trauma-informed organizational structure. Trauma-informed care involves viewing trauma through an ecological and cultural lens, recognizing that context plays a significant role in how individuals perceive and process traumatic events. This is a strength-based delivery approach grounded in being responsive and emphasizing physical, psychological, and emotional safety for both providers and survivors, creating opportunities for survivors to rebuild a sense of control and empowerment. This also means anticipating and avoiding responses and practices that are likely to re-traumatize individuals who already have a history of trauma. Folded within trauma-informed care are trauma-specific services. These services are evidence-based and refer to prevention, intervention, and treatment services that address traumatic stress as well as co-occurring disorders, including substance use and mental disorders that develop during or after trauma. Importantly, becoming trauma aware does not stop with the recognition that trauma affects survivors. Instead, this encompasses a broader awareness that traumatic experiences can extend to significant others, family members, first responders, and other medical professionals, behavioral health workers, broader social networks, and even entire communities. The Center for Healthcare Strategies Incorporated provides an outline for implementing a trauma-informed organizational structure. First, staff should work to create a safe physical and emotional environment. The majority of Kansas territory is frontier or rurally populated. The location and access to services can be a barrier in itself. Where offices are available, environmental design should be informed by client needs. For example, entrances and exits should be designed to allow for greater confidentiality and discretion, especially for structures providing a variety of services to both survivors and perpetrators. Second, all staff should participate in training focused on cultural sensitivity to trauma, safety, and privacy. A welcoming environment begins on the phone, at the entrance, or as late as the front desk. Organizations should strive for a welcoming atmosphere for youth and their families from all racial, socioeconomic, and cultural backgrounds. Third, training should include acknowledgement of secondary trauma. Professionals working with youth exposed to traumatic experiences may experience a personal emotional toll. The staff should be trained to detect secondary trauma and know their own available resources. Trauma is a systemic issue. Whether a direct survivor or secondary victim, well-rounded care means taking care of all involved. Those who work with youth have a demanding and extremely influential role in the lives of kids and their families. For at-risk populations, school administrators, counselors, health providers, faith-based organizations, and teachers are excellent resources for helping improve the lives of youth. Services and responses to trauma and abuse should be culturally responsive and culturally competent. Culturally responsive services honors and respects beliefs, languages, interpersonal styles, and behaviors of individuals and families. Cultural competence refers to a set of behaviors, attitudes, and policies that enable a system, agency, or group of professionals to work effectively. Fourth, agencies should adopt screening assessments from trained individuals. For example, the Adverse Childhood Experiences Questionnaire is quick and easy to administer and provides a general screening to guide future treatment and intervention. The ACEs-Q screens for the original ACEs risk factors, as well as community violence, time in foster care, and mistreatment due to racism and discrimination. To close, trauma-informed organizations should adhere to SAMHSA's 4 R's. First, agencies should realize the impact of trauma and understand the potential for recovery. Second, recognize the signs and symptoms of trauma in clients as well as families, staff, and others involved in the system. Third, respond by integrating knowledge about trauma in policies, procedures, and practices. Fourth, resist re-traumatization actively. You will now quickly see a list of additional resources for different roles in those working with youth. The National Child Traumatic Stress Network provides trauma-informed information for the juvenile justice system. The Center for Healthcare Strategies Incorporated leads the medical field in providing trauma-informed care to patients. Robert Wood Johnson Foundation grants access to resources for communities working to address the impact of adverse childhood experiences. The National Council of Juvenile and Family Court Judges works to educate judges on the complex nature of mental health and trauma-informed needs. The Annie E. Casey Foundation shares links, stories, and initiatives for improving outcomes for youth involved in the juvenile justice system. For example, foster parent support for kids dealing with trauma. For more information, including all information from this Ignite video, please go to the group's webpage at www.ourtownourkids.org. Thank you.
Our Town, Our Kids is a pilot project funded through the Kansas Department of Corrections, Kansas Advisory Group, and the Office of Juvenile Justice and Delinquency Prevention. The university group is K-State Juvenile Justice Collaborative, a multidisciplinary team from Kansas State University, Fort Hays State University, and K-State Extension. Ultimately, Our Town, Our Kids aims to empower local communities with a scalable, comprehensive set of tools which will stand as an exemplar to other counties across Kansas and beyond. For more information, please go to our website at ourtownourkids.org or reach out to us directly with questions, concerns, and feedback. Thank you for your time and attention.